Norovirus cases have been on the rise this holiday season. The CDC says 91 outbreaks were reported nationwide during the week of December 5th. That's roughly 24 more outbreaks compared to the last week of November.
Joining us now is Dr. Waleed Javaid, Director of Infection Prevention and Control at Mount Sinai Health System. Doctor, thank you so much for joining us. So what exactly is norovirus?
So it's one of the viruses that can infect our gut, our GI system, just like flu or COVID infects our lungs. This actually has propensity to infect our belly, our gut, our stomach, basically our intestines, and it can cause infection that includes nausea, vomiting, a lot of vomiting, and a lot of diarrhea, and it can be pretty intense for several days. And as you said, it's increasing in numbers.
And Doctor, where are we finding most of the outbreaks right now?
It's in a variety of situations. There has been, I was looking up, FDA has announced some links to oysters or raw seafood. But I think there's different areas. It's scattered. It's not like you can point to it's all happening in healthcare or daycare. It's all over the place right now.
So is there any treatment for the norovirus? You know, what can people do if they have it?
So treatment for norovirus, it's usually a self-limited illness, and you really need to recover, which is like hydrate, rest. And if you get too much dehydrated, which is possible in norovirus, is that you should probably go to the hospital to make sure that you get enough IV hydration or otherwise to get well.
And now sometimes it's impossible to avoid crowds during the holiday season. Any suggestions for keeping healthy when you're around large groups of people?
Yeah, so thinking about where does norovirus occur, it occurs in healthcare, and hopefully not a lot of people are coming to hospitals during their break. But like daycare, healthcare, if you're eating out, so the restaurants can have norovirus infections, and cruises. So when you're in those situations, I think making sure the surfaces are clean well. If you have somebody who has been diagnosed with norovirus, then make sure that all the surfaces they might have touched should be cleaned with bleach or diluted bleach, and making sure that you're washing your hands with soap and water. Cold sanitizer is fine, but it sometimes is not as effective as using soap and water to remove all the contaminations. And then making sure that people are containing their, if there's vomiting, it's contained within that environment, and if it isn't, then using gloves to clean that area is very, very important.
Okay, Doctor, thank you so much for your time. We really appreciate it.
It's my pleasure.
Thanks very much, Doctor.